Did you know that marijuana is the most commonly used federally illegal drug in the United States? Millions use it recreationally and medically, but what are the real effects of this controversial plant? How does it impact our minds and bodies? Let's delve into the science and separate fact from fiction. This video explores the multifaceted world of marijuana, examining its effects on our health, both positive and negative. We'll uncover the science behind its psychoactive properties, explore its potential benefits and risks, and address common misconceptions surrounding its use. Understanding the truth about marijuana is crucial for making informed decisions about its use. Marijuana, derived from the cannabis sativa plant, contains hundreds of chemical compounds. The most notable are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is the primary psychoactive component responsible for the high associated with marijuana use. CBD, on the other hand, is non-psychoactive and is often touted for its potential therapeutic benefits. Understanding the distinct roles of THC and CBD is key to comprehending marijuana's diverse effects. While THC can induce euphoria and relaxation, it can also lead to anxiety, paranoia, and impaired coordination. CBD, conversely, is being studied for its potential to alleviate anxiety, reduce seizures, and combat inflammation. The effects of marijuana vary greatly depending on the strain, potency, method of consumption, and individual tolerance. Factors like age, genetics, and overall health also play a role in how marijuana affects each person. THC and CBD exert their effects by interacting with the endocannabinoid system, or ECS, present throughout our bodies. The ECS plays a crucial role in regulating various physiological processes, including mood, sleep, appetite, pain perception, and immune function. THC primarily binds to CB1 receptors in the brain, altering neurotransmitter release and affecting areas responsible for pleasure, memory, thinking, concentration, sensory and time perception, and coordinated movement. This interaction leads to the characteristic high associated with marijuana use. CBD has a more complex interaction with the ECS. It has a low affinity for CB1 receptors and can even interfere with THC's binding. CBD's therapeutic potential stems from its interaction with other receptors in the body, including serotonin receptors, which regulate mood and anxiety. The immediate effects of marijuana are primarily attributed to THC's interaction with the brain. Users often experience a sense of euphoria, relaxation, and heightened sensory perception. However, these pleasurable effects can be accompanied by negative short-term consequences. Short-term effects include altered senses, such as seeing brighter colors or hearing sounds more vividly. Changes in mood, impaired body movement, difficulty with thinking and problem-solving, and impaired memory. Some users may also experience anxiety, fear, distrust, or panic. It's important to note that the intensity and type of short-term effects vary significantly based on individual factors, THC potency, and the method of consumption. Smoking or vaping marijuana leads to quicker absorption and more immediate effects compared to ingesting edibles, which can take longer to kick in but have a longer duration. Let's explore the long-term health effects of marijuana use. We'll delve into the potential risks to mental health, including anxiety, depression, and the potential for addiction. Additionally, we'll examine the impact of marijuana on brain development, particularly in younger users, and discuss physical health concerns such as lung health and cardiovascular risks. Research suggests that continued marijuana use can have lasting effects on the brain, especially when use begins during adolescence. The developing brain is more susceptible to the influence of THC, potentially leading to cognitive impairments, reduced IQ, and an increased likelihood of developing mental health disorders. Moreover, habitual use of marijuana is linked to an increased risk of psychiatric disorders, including anxiety and depression. Some studies indicate that heavy users may be more susceptible to addiction, characterized by the inability to stop using the drug despite negative consequences. Physical health concerns are also significant. Chronic marijuana smoking can lead to respiratory issues similar to those caused by tobacco, such as chronic bronchitis and lung infections. There's also emerging evidence that marijuana use may affect cardiovascular health, potentially increasing the risk of heart disease and stroke. While more research is needed to fully understand the long-term health effects of marijuana, it's clear that there are potential risks that users should be aware of. Making informed decisions about marijuana use involves considering both the immediate and long-term consequences. As we continue to explore this complex topic, it's essential to stay informed and weigh the benefits and risks carefully.